Hello, I'm Diane Miller, physician for alcohol law enforcement and reserve special agent. We'll be talking today about bloodborne pathogens. Our training objectives for today will include review the purpose of the bloodborne pathogen standard in OSHA 29 CFR 1910.1030. We will also be characterizing the symptoms and epidemiology of various bloodborne diseases, distinguishing the modes of transmission for bloodborne pathogens, identifying tasks and other activities which may involve exposure to blood or other potentially infectious materials. We will demonstrate methods which prevent or reduce exposure to blood or other potentially infectious materials and illustrate the appropriate selection, storage, use, and disposal of personal protective equipment or PPE. And finally, we will be outlining the components of our bloodborne exposure control plan, including appropriate actions and who you should contact in an emergency involving blood or other potentially infectious materials, the procedures you should follow if an exposure incident occurs, and information on the post-exposure evaluation and follow-up. Law enforcement officers face many dangers every day, whether it's from an armed gunman or danger from traffic. There are situations we think about, plan, and train for, and protect ourselves from consistently. There are also dangers we cannot see, such as bloodborne pathogens. However, this doesn't make them any less dangerous because more often we fail to take precautions against those things which we do not see. We're going to review several definitions that are involved with bloodborne pathogens. So specifically, the bloodborne pathogens are different viruses and infectious agents that are carried in blood and sometimes can be carried in other bodily fluids. OPIMs, or other potentially infectious materials, include some of those other bodily fluids. An exposure is any incident where the employee has non-intact skin, eye, mouth, mucous membrane, or under the skin contact with blood or OPIMs. There are certain definitions within the exposure control. So you have administrative controls, which include vaccinations, preventative procedures, and training programs such as this one. There are several engineering controls. So these are physical barriers to exposure. Those can include using masks or other devices to prevent the blood or OPIMs from contacting your skin. And then there's several work practice controls. So these are some of the procedures that we follow to reduce exposure, such as not eating or drinking around blood or other infectious materials, or using devices to handle things that could be contaminated. So we're going to review some of the symptoms and epidemiology besides the most common viruses and bacteria that you could face during the course of your career. We'll be reviewing hepatitis B virus, hepatitis C virus, HIV, and MRSA. Hepatitis B virus is a virus that targets the liver. It can be transmitted through blood and other activities. Some of the symptoms, once the liver does become infected and inflamed, can lead to jaundice or yellowing of the skin or eyes. People will oftentimes feel fatigued, may have fevers, loss of appetite, and weight loss. They may experience nausea and vomiting and abdominal pain, especially in the right upper part of the abdomen, and may have light or gray-colored stools. Hepatitis C virus is very similar to hepatitis B. The symptoms are the same because the hepatitis C virus is also targeting the liver. People who have been infected oftentimes will not have any symptoms. With hepatitis B, there is a vaccine that everyone who is employed by ALE should be fully vaccinated against hepatitis B. Occasionally, we find on applicant screening that some of our applicants are not fully immune, and so they may require boosters. Rarely, someone who has received the full series of hepatitis B vaccine still does not form an immunity against it, and so they are given counseling for the future if they were to encounter a bloodborne pathogen exposure. With hepatitis C, unfortunately, though, there is no vaccine. However, now we do have a cure for this. It's an approximately 6 to 9 month treatment that people can go through, which is pretty harsh on the body, but will be a complete cure. And so that will reduce any future transmissions of this virus to others. HIV has been known since about the late 80s. It initially was seen in populations where you would have people with unusual pneumonias and other types of illnesses like that. And eventually it was determined that it was due to a virus that attacks the body's immune system, the HIV virus. The HIV virus, when it populates enough in the body, can lead to different types of infections, like pneumonias. It can also lead to certain types of cancers. Some of the more common symptoms, especially early on in the illness, is night sweats, headache, fever, fatigue, swollen lymph nodes, muscle pain, and joint pain. These can be delayed from the initial infection with this virus or can be present early on. With HIV, there is no cure right now, and they're working on developing some vaccines to try to prevent it. But there are many treatments that are available that will help to reduce risk of developing HIV after an exposure. Something that you can take for a month after the initial exposure, and it's almost a 0% chance of contracting HIV if you do follow that protocol. MRSA, or methicillin-resistant Staphylococcus aureus, is a bacterial infection and initially was most prevalent in hospital systems and nursing facilities, but now it's everywhere in our environment. This can lead to lesions that look like pimples, boils, abscesses. It can also infect other areas of the body, including through the bloodstream. If it is not treated, it can be fatal or can be limb-threatening. Oftentimes people will present to the emergency department or to our clinic stating that they have a spider bite or bug bite. That is not the same as a MRSA infection. Very rarely do I see that those lesions are truly from a spider bite or bug bite, but instead it is a collection of this bacteria underneath the skin and can cause that swelling and pus to form. The bumps or infected areas will be red, swollen, painful, warm or hot to the touch, full of pus or other drainage, and sometimes can be accompanied by a fever or other symptoms, including body aches and pains. We treat this with antibiotics, and you can prevent it by performing proper hand hygiene with either an alcohol-based hand sanitizer or washing with soap and water for at least 20 seconds, and making sure that if you are laying hands on someone else, especially if they have an open wound or a concerning skin lesion, that you wear proper protection when doing so. There are various modes of transmission depending on the type of virus or bacteria. One of the most common ones that we think about are contacts exposures, and these are split into direct and indirect contacts. An example of a direct contact is when you have a pathogen that is passed directly from one person to another. And so that can occur if somebody is bleeding and you have an open wound and their blood gets directly from their wound to your wound. However, an indirect contact can occur when you're touching another surface or material that's infected with blood or OPIMs. Droplet exposures we see during cold and flu season, and this can occur when people are coughing, sneezing, or talking, as well as during eating. And these are larger droplets that will travel through the air into a person's mucous membranes. And then airborne exposures we see most commonly with COVID infections as well as tuberculosis. And these are microdroplets, so tiny droplets that leave our respiratory tract when we cough, sneeze, or talk, and will then travel through the air and go into somebody else's respiratory tract. With the direct contact, your greatest risk of exposure is going to be when you are providing first aid. Despite what's often thought, the actual bite, if you are bitten by a suspect or another subject, the bite itself is not what increases your risk of exposure, but if that person has their blood in their mouth, and then that gets into non-intact skin during the process of the bite. So for direct contact exposure, getting blood or OPIMs on clothing with intact skin below it is not considered a true exposure. But if there is non-intact skin, that is potentially an exposure. It can also be an exposure when blood droplets get into the mouth or eyes or other mucous membranes of a person. For indirect contact, we see this most commonly when people are processing evidence without using the proper PPE. There may be blood or other OPIMs on that surface. Also, when searching suspects and getting needle sticks through hypodermic needles is another great risk for indirect contact. Droplet and airborne exposure we just see with our day-to-day interactions. We saw this greatly with the COVID pandemic back in 2020 and 2021. We do still have COVID and flu and the common cold, as well as RSV and tuberculosis, but our numbers have shifted greatly since the 2020 and 2021 period. So what can you do to minimize risk? So we look at, in the next couple of slides, at standard precautions, transmission-based precautions, as well as work practice controls. So for our standard precautions, these are things that we should be doing all the time where there's a chance to interact with blood or other OPIMs. We want to do our best to try to avoid contact with blood and OPIMs whenever possible. We want to make sure that we're doing proper hand hygiene, either with soap and water for at least 20 seconds or an alcohol-based hand sanitizer. We want to wear disposable gloves as much as possible and use other PPE as needed. And then make sure that we're disposing of our contaminated PPE properly. And what that means is when you're peeling off of your gloves, going from the outside for the first glove and turning it inside out, and then using the clean hand and putting that on the inside of the second glove and turning it on the outside. You then want to make sure that these are properly disposed of in trash, and make sure that we are cleaning and disinfecting areas with an approved cleaner. For transmission-based precautions, these are specific to different types of viruses and bacteria that we know somebody is infected with. So if you know that somebody you're providing aid to or have gotten in an interaction with that has led to bleeding or the spread of other OPIMs, you want to make, and you know that they are infected with HIV or hepatitis, or they have an obvious rash or abscess that looks concerning for MRSA infection, we want to make sure that we're paying extra attention to the type of precautions we're using there. So these are in addition to the standard precautions. So for example, if somebody is coughing and they have a fever and they've recently traveled out of the country or been in a high-risk environment, we may be concerned about tuberculosis. And so we would want to wear appropriate N95 masks with them. Versus someone with an open wound, we want to make sure that we're doing the standard precautions. We want to try to isolate infected subjects from other people as much as possible. This is really important when transporting people to the jail, making sure that they are aware of any potential infectious symptoms or known infections so that they can isolate them from others and prevent any potential spread to other inmates or staff. And make sure, again, that you're using the appropriate cleanser. You can look at the label of most bottles and they'll tell you which viruses and bacteria they do prevent against. So you want to make sure that it's the appropriate one and not just a general cleaner. For our work practice controls, so these are our policies and procedures that help to keep you safe. One of the best things you can do is to avoid eating, drinking, or smoking around potentially contaminated surfaces so that you don't have that accidental ingestion. Make sure that you're not applying any makeup, lip balm, or handling contact lenses in potentially contaminated areas. You should be washing your hands with an approved alcohol-based hand sanitizer or soap and water for at least 20 seconds when doing either of those activities. And then making sure that we're not storing food in a refrigerator where evidence or blood or OPIMs are also stored, because there may be a potential for cross-contamination. For our PPE, there's several items that you may see, and we'll go over each one of those. The first one are gloves. So typically we'll wear nitrile gloves, which are a non-latex glove. These are appropriate to prevent against any kind of direct exposures with blood or other OPIMs. It is important to know that these are not puncture proof and can tear, so you do want to inspect them before you remove them. You want to wear this anytime there is a known risk or anticipated risk of encountering blood or OPIMs. Definitely wear whether you have an open cut or not. And then again, you also want to try to wash your hands in an approved way before and after removing the gloves. Make sure that you're disposing these properly, as I described earlier, and make sure that you do not reuse these gloves. Gowns are something that we won't typically see in the line of work that you all do, but you may do Tyvek suits or similar clothing coverings, but we want to make sure that we're not getting our clothing contaminated with blood or OPIMs. This is especially important if you're processing scenes, and if possible, if you're going to be involved with somebody that's being transported by EMS and they do have open wounds, to consider wearing some additional PPE like gowns. Make sure that after you have used gowns or Tyvek suits that you are disposing of them properly in the correct receptacle, and make sure that they are labeled so that nobody else gets an accidental exposure. Masks, we dealt with a lot in 2020 and 2021. We should make sure that we're considering wearing masks if there's going to be any potential splattering or splashing. Make sure that if you know somebody has an airborne or droplet infection, so things like the cold, the flu, tuberculosis, COVID, that we are wearing the appropriate mask. So if it's going to be airborne exposures, so those micro droplets from tuberculosis and COVID, you want to wear an N95. If you are dealing with the cold or flu, those are larger droplets, and a regular face mask is appropriate. Eye protection is important to protect against splashing and splattering. It's important, just like at the range, to remember that our typical eyeglasses are not sufficient to protect our eyes against blood exposures and OPIM exposures. These may be disposable, and so you do want to dispose of them in the proper receptacle. If they're not disposable, again, make sure that the cleaner that you're using is appropriate for the type of infections you're trying to eliminate. For CPR, they give you two options for when you're providing rescue breaths to someone. The top option, the face shield, I would not recommend. It will not protect against most of the bodily fluids that are released during a cardiac arrest, and so they really are not sufficient. If you do not have access to a full face mask, like in the picture below, I would recommend that you just do compression-only CPR or within your comfort level. But really doing the mouth-to-mask, or if you have access to a bag valve mask, those are ideal compared to the regular face shields. When you are getting rid of any potentially contaminated items, you want to make sure that you are using a biohazard bag. These are thicker than our standard trash bags. They're clearly labeled. You want to make sure that if it's something that has sharps, that it is in a proper sharps container, and so you can access those through EMS or at the hospital. Make sure that we're labeling everything that is in there and that we're disposing of it properly, whether it's okay to go in the regular trash versus needing to be disposed of through EMS or at the hospital. So our exposure control plan will go over at the conclusion of this talk, but we must review per policy our plan annually, and we update it as needed. This was updated during 2020 and 2021 during the COVID pandemic. But now that we are not seeing numbers to that level, we're going back to more of our original plan. Through federal law, we are also required to provide hepatitis B vaccinations. You are not required to take this, but it is strongly encouraged, as if you have an exposure and you have not been vaccinated, it is increasing your risk considerably of getting a very preventable disease. Your contact person is going to be through the Highway Patrol Medical Office. The phone number for our office during normal business hours is 919-662-4490. And our after hours physician on call is 919-880-3203. We will give you some guidance on whether this is considered a true exposure and if it's after hours where you need to go to get your initial evaluation. And then we will be managing your follow-up care, including any potential medications for HIV prophylaxis. So in review, our training objectives, we cover the purpose of the bloodborne pathogen standard in OSHA 29 CFR 1910.1030. We characterize some of the symptoms and epidemiology of the bloodborne diseases. We have distinguished the different modes of transmission for bloodborne pathogens, identified tasks and other activities which may involve exposure to blood or other potentially infectious materials, demonstrate methods which prevent or reduce exposure to blood or other potentially infectious materials. We've illustrated the appropriate selection, storage, use, and disposal of personal protective equipment. And finally, we will be outlining our employer bloodborne exposure control plan. And with that, we're going to switch over to our exposure plan.